The chair now recognizes Dr. Grossman for 5 minutes for your opening statement.
Sex is not assigned at birth. Sex is established at conception, and it's recognized at birth, if not earlier.
Minors with gender dysphoria.
Kids know their genders, and transgender kids know their genders.
Making irreversible medical decisions that they may regret later.
Once I hit 14, I kind of hit the point of like, no, I'm definitely not a female.
This is a medical scandal. We are not doing a favor to these kids by affirming them. If she is put onto that medical assembly line and she's given puberty blockers followed by testosterone and possibly surgery, she is on her way to being a lifelong patient, a lifelong consumer of drugs, of pharmaceuticals. And that one child represents a profit of about $1 million to the drug companies.
Can we talk about the double mastectomies, the castrations, the creation of these kind of sex holes, and you hear some of this stuff and it's just really hard to know that that might be happening to these young children. What is this assembly line, and what are some of those things that are actually happening to these young kids?
They take the tissue from the penis and the scrotum in order to construct that structure. But in these kids, these boys whose puberties have been blocked at an early time, they don't have enough tissue to make that so-called vagina. They have to borrow tissue from some other place in the body. Let the kids grow up. Give them psychotherapy. Give them support. Give the family support. That is the way that we treat emotional disorders. We are talking about an emotional disorder.
The world is changing. Inspiration is everywhere. It has never been so easy to connect, share, and bring people together. We're learning from others and finding the best in ourselves. Challenging our beliefs. Sharing our vulnerability. Overcoming our fears. Transforming ourselves so we can transform the world. How far can we go?
This is London Real. I am Brian Rose. My guest today is... This is London Real. I am Brian Rose. My guest today is Dr. Miriam Grossman, the physician, author, and public speaker. You specialize in the areas of child and adolescent psychiatry, with a particular focus on gender-distressed young people and their parents. You've written 5 best-selling books, including You're Teaching My Child What? In 2009, which warned of the potential dangers of sex education long before gender ideology had become mainstream. Your recent book, Lost in Transnation, A Child Psychiatrist's Guide Out of the Madness, encourages parents to reject the advice of gender experts and politicians and trust their guts, despite a wave of ideologically driven misinformation. You ultimately believe young people are making risky decisions that will detrimentally impact the rest of their lives, and that every child is born in the right body. Dr. Grossman, welcome to London Real.
It's great to be here, Brian. Thank you for having me.
It's my pleasure. You know, I have 2 young boys who are 6 and 7 years old, but I live in the UK, and so this conversation hasn't come up with them. But I have to tell you, doctor, if they were able to decide to change their gender medically without my consent, I mean, I don't know how I would react. I mean, that whole concept is really foreign to me, being in the UK, now that I'm no longer in America. What can you tell me and maybe the rest of the world about the state of the union now in America of gender ideology? What is going on there on the ground?
What's going on the ground here is that professionals like myself are instructed by our medical organizations to rubber stamp a child's new identity of the opposite sex, regardless of their age, regardless of their underlying emotional issues. They may have autism or severe anxiety, depression. They may have gone through something traumatic in their lives. They may have gone through any number of things that may have led them to want to assume a different identity. But we are supposed to, in a kind of a knee-jerk reaction, put our stamp of approval on the new identity, use the new name, the new pronouns, inform everyone in the child's life, the school, neighbors, grandparents, to celebrate the new identity and to put the kid into the driver's seat. That's what's going on in the US.
And what age does this start at, and what age does this happen typically?
Okay, well, you see, what's going on with the gender issue is that we have always known in psychiatry that it exists. We've always known that gender dysphoria, meaning an intense discomfort with one's sex, we've always known that that exists, at least for the past 100 years or so. But until now, there's really only been, let's say, 2 populations in which this symptom of gender dysphoria was found. It was found very rarely in young boys, mostly young boys, a majority, like 80% of the kids that had gender dysphoria were little boys years before puberty. So they might have been 2, 3, or 4 years old, and they are consistently coming to their parents and saying, I'm not a boy, I'm a girl, or I am just praying to God to wake up tomorrow and be a girl. They are, they have more stereotypically feminine interests, and instead of playing with trucks, they're playing with dolls and all these kind of stereotypes. Now, those group of kids are said to have childhood onset gender dysphoria, and we know that the vast majority of them, as they grow up, they will grow out of it. So we have 11 studies from different clinics in the world that have studied these kids, even though they are extremely rare, and by rare I mean 1 in tens of thousands, if not hundreds of thousands of people. Until 20 years ago, Brian, there were only 3 clinics in the entire world that would treat these children. 3 clinics. Now in the US, it's hard to know exactly how many we have, but we have at least 100. So, that points out what's happened over here. Things have exploded. But let me just get back to these 2 populations that we used to study. The other population were middle-aged heterosexual men who enjoyed cross-dressing. And at some point after they had their families, they got married, had families, they decided that they would like to live the rest of their lives as women or appearing as women. They're not actual women. And so those were the 2 groups that we were focused on in psychiatry. Now, not long ago, maybe 8 years ago, a new phenomenon occurred, a new demographic of kids, and these were teenage girls. The majority of them, teenage girls. And so we're in the midst right now of an epidemic of it's a new demographic. It's a new cohort of kids that we have not seen before. They are mostly girls. There's a lot of boys as well, but the majority are girls. They have pre-existing mental health problems. They have depression, anxiety, trauma, autism, all sorts of issues that existed before the new identity. They don't have a history of complaining about being a girl. Many of them were what we call girly girls, very feminine, very into all the stereotypical girl things. And they have a history before coming out as transgender of being immersed in internet, social media, YouTube videos that are promoting this idea of being born in the wrong body and of promoting the idea that perhaps you're transgender and that you will feel better, you will no longer be depressed, you will no longer have trouble making friends, you will fit in with people if you live as the opposite sex and so to speak, transition. So this is a new group of kids. The other thing that's so remarkable is that a majority of these kids are within a friend group, either online or at school in person, a friend group that has one or more other young person who's identifying as transgender. So what I'm getting at here is that there is a social contagion component to this, which is not the case with the other groups that we knew about before. The little kids, they're 4 years old, they're 6 years old. They're not on the internet. They're not, well, at least, in the past, decades ago, right? It was something internal in them that they somehow were at odds with their bodies. We don't know why, because physically, all these individuals that I'm describing here, they are 100% healthy. There is no evidence of any biological component to this symptom of gender dysphoria. Now, the proponents on the other side will argue that this is something inborn, that it's biological, that it's unchanging. That is not true. There is no high quality evidence of any of that being true. So what we have here right now, and the best data that we have comes from London, comes from your Tavistock clinic, right? We have evidence of a increase in the past 10 years, about 10 years, of 5,000% of the number of referrals made to the Tavistock clinic. So this is a new phenomenon. We are only beginning to study these kids right now, but because the predominant narrative is one of promoting what's called gender affirming care, an Orwellian term, because when you affirm the opposite sex identity, you are denying the biological reality. So you have a girl, she's 12 years old. She comes to you and she says, I'm not your daughter, I'm your son. I want you to use this boy's name. I want you to use boys' pronouns. Take me to a gender clinic. Stop my puberty. That is gender affirming care. But if we follow what gender affirming care is calling for, then people like myself and parents, teachers, everyone, like I mentioned, is supposed to affirm that new identity. But when you affirm that new identity, let's just keep in mind that you are denying the biological reality. So what I'm arguing, and I say over and over again in my book, Lost in Transnation, I say that we are not doing a favor to these kids by affirming them. They may be happier in the moment. They may be happier for 6 months or a year or even a few years. But in the long term, we are not doing a favor to them by lying, by endorsing a falsehood, because that girl is always going to be a girl and she can never be a boy. Furthermore, if she is put onto that medical assembly line and she's given puberty blockers, followed by testosterone and possibly surgery, she is on her way to being a lifelong patient, a medical patient, a lifelong consumer of drugs, of pharmaceuticals. Testosterone is a powerful drug, and it has a long list of negative effects. So this is a girl, when placed on this assembly line, and I can explain to you why I call it an assembly line. She is being medicalized for the rest of her life, and that one child represents a profit of about $1 million to the drug companies.
And what does this assembly line look like, if we're going to be really specific, doctor, for, say, a young girl at 12 and a young man at 12 as they go into this transition? Because some of it is really hard for me to fathom or stomach, concerning the surgeries and the blockers, and what do they end up doing on this assembly line? And then, like you said, it continues the rest of their life because there are medical issues that resort from this. But what are the things they're doing to these young kids?
Well, Brian, it is hard to talk about, but we have to, right? That's exactly why we do have to talk about it, because it is so awful. I mean, in many cases, it really can be, the worst nightmare that you can imagine. And I get contacted all the time by parents that are going through this. And I devote a chapter in the book to the parents. I know you're not asking me about the parents, but when we talk about the casualties of this, what I call belief system, it's more like a religion than anything else, because it's not based in science or medicine. But when we talk about the casualties of this belief system, we have to also consider the parents, the siblings, the grandparents, and others. But to get back to your question about what we are actually doing to the children. Well, if you want to start with the medical things, the medical interventions, they would follow the what's called social transitioning, which we can also speak about later on if you want. But the first step in terms of any sort of medical intervention would be in the form of puberty blockers. Now, I want to explain that puberty is not a disorder. Puberty is not a disease. Puberty is the most important developmental process that a person goes through after birth. I mean, aside from the development that goes on in the womb, puberty would be the most significant and far-reaching period. In order to become an adult, and I'm not only talking about appearing as an adult and having facial hair and a lower voice and growing breasts and all of that, I'm talking about every system in the body. Okay, every system in the body is impacted by puberty. Well, let's just focus on the brain. The brain goes through massive changes during puberty, and there's a restructuring, a changing in the size and in the neuronal connections within the different parts of the brain, and also between the different parts of the brain. And that is why the brain of an adult is very different than the brain of a child, not only anatomically to look at it, to scan it and look at it anatomically, but in its functioning. So, we expect an adult to be, when they have to make an important decision, for example, they're going to make that decision, hopefully, not on the basis of their emotions and how they're feeling. I mean, that may enter into it, of course, but when you're making a big decision in life, you want to be using your head, right? Not your heart. You want to be thinking of the pros and cons. You want to be thinking of possible consequences. What if this happens? What if that happens? What are the downsides? What are the upsides of this? And that is all taking place in a part of the brain called the prefrontal cortex. And it is right behind the forehead there, the prefrontal cortex. Now, it takes until about the age of 25 for that part of the brain, which is the CEO of the brain, the thinking part of the brain, to mature, mid-20s. Now, if you take a 12-year-old or 15-year-old, the part of the brain that they tend to rely on is the emotional gut feeling at the moment part of the brain. I'm not telling you, you have kids. I'm not telling you anything you don't know. Kids want what they want because of how they feel at the moment. They're not thinking about how they might feel in a few hours or next week, or let alone in a few years. They're thinking about how they feel at the moment. Now, you need to go through puberty, and your brain needs to be exposed to those, either testosterone or estrogen, depending on whether you are a boy or a girl, in order for your brain to mature. Now, I'm oversimplifying a lot of things, but that's the bottom line. And this is why we adults are supposed to understand that kids cannot make big decisions. We don't even let a child decide whether to get a tattoo because it's permanent. I don't know about where you are, but in the US, you need an adult consenting for that permanent tattoo because it's permanent. Now, and all sorts of things. We don't let kids, drive. We don't let kids vote. We don't allow them to get married until they reach a certain age, join the military, have an abortion. So we recognize in every other area of medicine and of life, right, that kids are different than adults.
Now, can I just jump in there, doctor? Because I think your critics say that the puberty blockers are safe and reversible medications that give those transgender children time to explore their identity before they make a decision like hormone therapy or surgery. I mean, how do you reply to that?
Well, I replied by saying, let's look at Sweden. What happened in Sweden, the most GLBT-friendly country on the face of the earth, probably? They were gung-ho, like the US is now, like Canada, very gung-ho on gender affirming, meaning blockers, hormones, and surgeries for minors. They were gung-ho. What happened? Well, along came a girl who was identifying as a boy using the name Leo. Leo was put on blockers at the Karolinska Hospital in Sweden. And her parents were told, just what you said, safe, reversible, this is the way to treat your daughter. This is what will help your daughter feel better. Your son, they probably said your son. So the parents signed on the dotted line. And Leo was put on blockers. Well, her mental health deteriorated. It got worse than it ever had before. And not only that, but she began to complain of pain, pain in her spine, pain in her hips. She began to have difficulty walking and keeping, her spine upright. And she was complaining and complaining. Nothing was done. She was kept on the blockers for a few years until the point came when her parents said, what is going on with our child? Our child is in severe pain. They ended up doing the necessary scans. They discovered she has osteoporosis. Osteoporosis, it means that the bones are weak and brittle and easily broken. So Leo was discovered that Leo had fractures in her spine and permanent damage to her skeletal, as well as osteoporosis, because of the osteoporosis, I should say, which is a disorder that normally older women suffer from. So, you asked me about blockers. Are they harmless? Absolutely not. Blockers, there's a long list of problems that are related to the blocking of puberty.
And what do Sweden and Finland and Norway do now with the blockers? Have they now stopped issuing those to children unless there's a proper psychiatric diagnosis?
So what happened, I'll just finish off Leo's story. An investigation was launched. A documentary was made that everyone should watch. It has English subtitles. It's called Trans Train. And it tells the story of Leo and what Leo went through. The hospital ended up issuing an apology after they did their own internal investigation, and they acknowledged that it was not, the parents were not properly informed about the dangers. They acknowledged that they had, in short, committed malpractice, and they apologized to Leo's family as well as a bunch of other families whose kids had been placed on blockers. And then the government, the Swedish, the medical authorities did their own investigation, and the country ended up essentially banning these blockers and processed hormones for minors unless it's happening within the framework of a clinical trial. A clinical trial means that some institution, a hospital or a medical center is very closely monitoring these kids, very closely deciding who should be in the study and who should not be in the study. It's research. It's to gather data so that we have more research on this issue. And the Swedish medical authorities came to the conclusion, after reviewing all the literature, that we simply don't have evidence of long-term benefit in these minors, but we do have evidence of significant harm. Now, so it's not only Sweden, it's also Norway, Finland, England. Also, I'm sure you're aware, there's a CAS report that was done looking at the practices at the Tavistock Clinic.
Can we talk about the Tavistock? Because I haven't had anyone tell my viewers what happened there. This is right here in London, and this clinic has become infamous for its practices, I think, over the past 7 to 8 years. Can you talk about what happened there?
Yes. Well, I would suggest also that I want to mention there's an amazing book that just came out by Hannah Barnes, right? Hannah Barnes, called Time to Think. I'm in the middle of it right now. So what happened, just briefly, at Tavistock is that Tavistock was opened, I believe, in the 80s, at a time when there were only 2 other clinics in the entire world. Like I said, these kids were very, very rare. So Tavistock opened at the time that there were 2 other clinics, one in Toronto, one in the Netherlands. And they had very few patients every year, very few referrals. I mean, a dozen, 20 every year. And what happened is that there was research that came out of the Netherlands. The Netherlands really was they were considered the experts in the world on medicalizing kids. They were the first people to do it, to use blockers. Blockers are used in other conditions. They're used in a condition called precocious puberty. In fact, they're approved by the FDA in the US for use in precocious puberty. But let me explain what precocious puberty is. Precocious puberty is a medical condition in which little kids enter puberty. So, little girls and boys, they might be 6, 7, 8 years old, begin to develop secondary sex characteristics, and we don't want that. That's going to be a psychological trauma, and we obviously don't want little kids going through precocious puberty. But you see, these kids have abnormal hormone levels. You can study their blood levels and you see that the numbers are off and that something has happened to them physiologically. For some reason, they began to release estrogen and testosterone to the degree that they're entering puberty, which we don't want. So we use puberty blockers in those kids. They act on the brain and they tell the brain to stop, basically to stop the release of those hormones. So the kids take puberty blockers for a few years. And then when they reach the age, or before they reach the age of normal puberty, 11, 12 years old, you stop the blockers and they go through a normal puberty. Now, Puberty blockers are also used in other situations where you want to cut down or eliminate testosterone levels. For example, men who have certain cancers, prostate cancer, for example, you don't want them exposed to a lot of testosterone. So these are all medical disorders. Okay, that's what I really should be focused on here. Medical disorders, you can have, you can see and measure abnormalities, in the body or in the blood. Now, when we use puberty blockers on these kids with gender dysphoria, they're healthy. So this is a new application for these drugs. And what happened is that the Dutch were looking at those individuals, adult men mostly, who had undergone sex reassignment as adults, but they were still not doing well. So they were living as women, and they had gone through all the medicalization and surgeries, but their appearance was not feminine enough. And it was hard for them to pass as women, and they were struggling psychologically. So they still had a lot of depression and anxiety and suicide. And so the idea that the Dutch researchers had, and this was in the 90s, was why don't we try and figure out if we can identify those patients before they go through male puberty? Because why are they having difficulty passing when they're adults? It's because they've gone through the masculinizing process of male puberty. They were exposed to all the testosterone, which lowered their voice, and they grew the facial hair and the body hair, and they have broader shoulders and bigger hands and bigger feet and male pattern, baldness and all that sort of thing that makes it more difficult in their futures to pass as a woman. So they said, why don't we block their male puberty and put them through female puberty? And then if they want, they can have surgeries, and then they will really appear more feminine. And then their mental health will be better. Are you following me? This is what
that's fine.
Was.
And then, so what happened?
Well, what happened is, this is, a whole chapter in my book. What happened is that the most important thing, Brian, for me to say here, is that the kids that they chose to be in this experiment, this study, had to, A, have had severe gender dysphoria from a very young age, A, and B, have no significant mental health issues. So, and they were very strict on those criteria. It was a small study. They eliminated a lot of kids. There were all sorts of problems with the study. And on the other end of it, there was evidence of some improvement, but over the long term, over many, many years, in the end, they're really not doing that great. But when the Dutch started doing this and reporting early success, like, for example, they gave the blockers the cross-sex hormones, and they were reporting that the kids felt better and the kids were doing better. And therefore, this idea of using the blockers on minors to prevent puberty started to spread. It shouldn't have, because there wasn't enough evidence. It was one small study. All of gender-affirming care is based on one small study from the Netherlands called the Dutch Protocol. That's what all of this is based on. So getting to Tavistock, the people at Tavistock got excited about what was happening, what the Dutch were doing. And so they brought that into, what they were going to offer to their kids. And there was dissent, there was disagreement. They tried to replicate the study that was done in the Netherlands. They were unable to. In other words, they took at the Tavistock a group of their own kids, and they put them on the blockers, and they did not find that they did well. They were not improved, but that was not published, you see. that the results of that was not, and the truth is that no one to this time, to this day, has replicated that Dutch study, that original study from the 90s and 2000s that started coming out, which was declaring that this is the way to help these kids. Now, mind you, you see, I just mentioned, but let me say it again. The kids that the blockers were given to had gender dysphoria, intense gender dysphoria, from an early age. And as they entered puberty, it got worse. B, they did not have significant mental health issues. They would be disqualified if they had those issues. And what did they start doing at the Tavistock as well as other clinics? They started giving these blockers to a totally different population. Kids that developed gender dysphoria later on in life as adolescents. Kids who had severe mental health issues. Okay, severe anxiety, cutting themselves, suicidal, autistic. And so, and they used their justification to this day of giving the kids blockers. Their justification is that this has been shown, hands down, this helps kids. But if you just if you just look at this, for 5 minutes, if you look at it, and you look at the history of this and the lack of evidence, the lack of long-term evidence that these people did better. And if you take into consideration all the potential problems of the blockers, now let me say something else. So kids are put on blockers and the parents are told, we're just giving your child time to think about this. Your child isn't sure about their identity. We just want to stop the puberty because if your daughter experiences her periods and her breasts, she's going to get more upset. So we're going to stop that and we're going to give her time to think. Well, let me explain. Over 90% and possibly 98 to 99%, depending on the study, of kids placed on blockers go on to the cross-sex hormones. They move forward. They don't get off desensitized. They move forward with it. That's number one. Number two is that the blockers themselves have a dangerous impact. As I mentioned a few minutes ago, that we need puberty, natural puberty, to develop and become an adult and have an adult brain. But more importantly, puberty itself may be the solution to the gender dysphoria. Why do I say that? Because the studies that we have of those younger kids who had intense gender dysphoria for years when they were 4, 6, 8, 10 years old, we know from 11 out of 11 studies that a majority, 60 to 90% of those kids with puberty, with natural puberty, will outgrow it. They're going to outgrow this discomfort that they have with their bodies. Many of them will be gay and lesbian, but they no longer want to live life as the opposite sex. They have their fertility. They have their normal sexual response. They have normal genitalia, to say nothing of all the other body systems that are affected by gender affirming care. So you see, it could be that by giving the blockers, followed by the cross-sex hormones, instead of allowing this condition to live itself out and resolve, we are cementing it in. We're fixing it.
Understood. And then Tavistock became very famous. They made a lot of money. They treated even more and more patients. And then finally, I think there was an investigation and there was evidence that they weren't necessarily doing the right things.
Well, there was a huge scandal, yes. The therapists there, a large number of therapists became really concerned about what was going on. They were seeing one kid after the other come in with serious mental health issues. And requiring a good evaluation, requiring treatment, and instead of a thorough evaluation and treatment, which takes time, okay, when you're talking about psychotherapy, psychiatry, treating all these disorders, it takes time. And what many of the therapists were seeing was that it was rushed and that kids were being referred to endocrinologists for the blockers and the hormones. It was too fast. And they were uncomfortable to the degree that 30 therapists resigned. Wow. In opposition to what was going on at Tavistock. So, it's the story of a scandal. Then there was Kiara Bell, one of the patients at Tavistock, a woman who went through gender affirming care, was put on testosterone, grew a beard, voice was lowered, had a bilateral mastectomy, and then regretted. So she came forward with her case and her complaints, and it was brought to the British High Court. And the High Court looked closely at what happened to Kiara Bell. And one of the things that they said in their conclusion was that minors cannot consent to these procedures. So then there was Dr. Hilary Cass, the pediatrician, very prominent pediatrician, reviewed the data, reviewed what Tavistock was doing, and she also came out with quite a damning report. So that's kind of the on one foot what happened to Tavistock.
Okay, and look, you've mentioned what happens kind of after the puberty blockers, but can we talk about the double mastectomies, the castrations, the creation of these kind of sex holes, and you hear some of this stuff, and it's just really hard to know that might be happening to these young children who will regret it later, who will have lifelong medical conditions. But, what happens after the puberty blockers? What is this assembly line, and what are some of those things that are actually happening to these young kids?
Okay, well, I'll explain one thing in terms of the boys. If you give a puberty blocker, it's actually true for the girls as well, but if you see, in order to be able to reproduce biologically, to have a child, you need mature sperm and eggs. If your eggs and your sperm never mature, and you go into, you have blockers and then the cross-sex hormones, it's pretty clear that a lot of these kids, especially the boys, even if they try and reverse things, they're never going to get back. They're never going to get that ability back. So when they go on the blockers and their development is halted, that means their genitalia do not normally develop. With the surge of testosterone, normally a boy's genitalia changes, and his testicles enlarge.
To continue watching the rest of the episode for free, visit our website londonreal.tv or click the link in the description below.
So Jim Rickards has just recorded a video that's not available to anyone in the public, and he's going to be talking about how this upcoming recession is going to be fast, it's going to be bloody, it's going to be nasty. But at the same time, he's going to show you how you can position yourself to profit from all of this chaos. Now, we've made this video only available to our viewers. Go to londonreal.tv/Jim. Watch that immediately. I can't say enough good things about Jim Rickards. He understands the global economic system better than any guest I've ever had on London Real. His predictions are almost uncannily true, and you can learn how to profit from his vision, from his expertise, and his understanding of economics. So go to londonreal.tv/Jim or click the link below. It's an excellent, excellent look on what's going to happen in the future and how you can position yourself to profit from that. Jim is one of the best in the business, one of my favorite guests on London Real, and he's very, very good at predicting the future and showing us all to profit from it. So click the link, and I hope you enjoy. Hey, do you want to profit from crypto? Then join my DeFi Academy. The Crypto DeFi Academy will help you create generational wealth. But don't take my word for it. Listen to my students.
When I first got into crypto, I remember thinking to myself, I need to learn more. Brian Rose, learning crypto, learning DeFi, gotta do it.
I am so grateful that I jumped in and did this. I had to break through some limiting beliefs that I can do this, that I can afford this, that I can be in this.
It challenges the things that are deeply rooted within us.
Joining DeFi Academy has been one of the best decisions I have made on my blockchain journey.
This course was a life changer, a game changer, a huge eye-opener, coming from knowing practically nothing at the speed of the learning over 4 weeks was just fantastic.
The information you provided in this class was invaluable.
I feel far more confident in my next steps.
You took complex concepts and made them easier to understand.
What's different than so many other ones is it just doesn't tell you what to do. It actually makes you do it.
This is for people who are serious about becoming traders. This is the way it should be done.
I realized from this learning experience again that it is not about what you learn, but about who you learn it from.
The energy was insane. I've never experienced such incredible energy on a live call. Brian Rose, you are a legend, my friend.
It's the only thing in the market where you can get all information and learn everything what you need to know.
Everything is so clear and so well done, and I'm just forever grateful for this program.
It made me feel so much more confident about crypto than I did before.
I did not anticipate how passionate I was going to become about it.
This course has been like a big learning experience for me, not just in the crypto space, but just in overall balance of life.
What I've learned is, how to take ownership, of my life in a way that I really hadn't before.
Yeah, you can't put a price on that, really.
I would recommend it to anybody, top notch.
Excellence does not come cheap. So if you want excellence, you gotta pay for it, but it's so worth it.
Pull the trigger. That's what this course is about.
You're not going to regret it, really. It's amazing.
Thank you, Brian and team.
So what are you waiting for? Crypto is happening now. Click the link below, submit your application, and let me mentor you on how to create generational wealth and build the decentralized financial infrastructure of the future.